And joining us now is President Biden's HHS head, Xavier Beccera. Thank you so much for your time tonight. You've seen the cuts today. You said on social media, quote, that this has the makings of a man-made disaster. What concerns you most?
We are dropping the ball. We're letting America be unprotected. We are allowing something like a COVID virus to come in and not be prepared. HHS's biggest duty, Linsey, is to stay ahead of these things. And when you gut agencies like the Food and Drug Administration and some of these personnel, you miss things. And take those, what was it, about 10, 15 years ago, when some of these toys that were being imported from China that our kids were sticking in their mouth, we found out were laced with lead. And so we had infants actually sucking on toys that had lead in them. FDA is the agency that discovered that and made sure that stopped. When you lose that kind of expertise, everyone's health is in danger.
We've seen several measles outbreaks. Bird flu is spreading. You just mentioned COVID. We're, of course, a few years out from that pandemic. Is the agency equipped right now to handle another serious global pandemic?
We're always on the edge. We're always fighting hard to stay ahead. But if you're going to gut 25% of your workforce, how do you stay ahead? We're talking about the things that we know about in this country. Ebola, we've heard of Ebola, but we haven't had to worry because we've been able to fend it off. Why? Because we work with countries where it is spreading to keep them safe. So that way, if they're safe, it'll keep us safe in our borders. But if we're going to gut so many of those personnel that work with some of these other countries, then Ebola will spread. And Ebola is extremely deadly. If it gets here, it's too late to try to stop it.
HHS head Robert F. Kennedy Jr. said today, no American is going to be left behind. Your response to that?
Prove it. We're getting to this point where over and over we keep hearing that, we can do these things. Remember, Republicans in Congress just approved these budgets for these agencies that now this administration is saying it's going to cut because they don't need them. What were Republicans in Congress doing then if they just recently approved these dollars for these personnel? It doesn't make any sense. At the end of the day, what you're doing is you're leaving yourself exposed. And as I said, if I were seeing the blaze, if I were seeing the smoke, I wouldn't wait. I'd pull the alarm. It's time to break glass.
You mentioned the toys that had the lead in them, for example, but just how many aspects of our everyday lives does the HHS touch?
If you have your elderly mother or grandfather in a nursing home, who inspects those nursing homes? Health and Human Services. If you're trying to make sure that your kids are safe in their Head Start programs, who oversees Head Start? HHS. If you're trying to make sure that we continue to see the trend that we saw under the Biden administration of seeing opioid overdose deaths and suicides go down finally after several years of leaping high, then you don't make the cuts that you're seeing this administration make in our department that deals with mental health. If you want to keep seeing 988, which is the program we stood up nationally to make sure if you're suffering from a mental health crisis, you can call 3 digits, not 911, 988. How do you keep that going if you're gutting the agencies that do that work?
There's been a lot of talk about a brain drain. I'm curious your thoughts on the impact of HHS grants being canceled and researchers deciding or being forced ultimately to go to a different country altogether.
Yeah, remember, Linsey, you don't just get a grant because you want it. You have to apply. You have to compete. You have to prove you're the best one ready to move forward that research idea that will bring an innovation to Americans to help them stay healthy and maybe stay alive. All of a sudden, you have the rug pulled out of you and your research money is gone. You've spent your many years, not just in graduate school, but now doing the research. And all of a sudden you're told, stop, and you're not given a reason. That makes no sense. We are the premier place for healthcare research and innovation. But, if you continue to do this, I could see where we'll lose some of our brightest minds to other places in the world where they know they'll get to do their work. It's unfortunate. And right now, perhaps most Americans don't see the impact of this because they've got their health insurance or they feel pretty healthy. Just wait. No one expected COVID to be so serious. We had a president at the time who kept joking about how you don't need masks. And then when we lost more than 1 million people, we saw it. Under our watch, we put some 700 million vaccine in the arms of Americans. And that's why today we pulled out of COVID. Today, our economy is the strongest in the world. It's not because we just waited and we took for granted and let COVID take us over. We got ahead of it.
Is it too late at this point? Could Congress step in? Would anybody be able to say, hey, we do actually need some of these people to be in place?
It's not a question of whether Congress would step in. Congress should have stepped in already. Congress approved these funds for these agencies to do this work. And just recently, Republicans and Democrats voted for these budgets that these agencies rely on. All of a sudden, the administration is now saying, we don't need it, we don't want it, and we don't want the people who are supposed to do that work. Makes no sense. What I don't understand is, why isn't Congress doing its job of oversight over this branch of government, the administration, to make sure what they're doing makes sense and is compliant with the law? I would say in both counts, it doesn't make sense and it's not compliant with the law.
Secretary Beccera, we thank you so much for your time and insight. Really appreciate it.
Thank you.